On June 26, Ghana will be joining the rest of the world to observe International Day Against Drug Abuse and Illicit Trafficking. According to the 2021 World Drug Report, around 275 million people used drugs worldwide in the last year, while over 36 million people suffered from drug use disorders. The report released today further noted that in the last 24 years, cannabis potency has increased by as much as 4 times in parts of the world, even as the percentage of adolescents who perceived the drug as harmful fell by as much as 40%, despite evidence that cannabis use is associated with a variety of health and other harms, especially among regular long-term users. This afternoon, we're breaking down the figures and looking at the situation here in Ghana. And joining me in studio is Nana Beniwa from Pombedu. She's from the Legal Department of the Narcotics Control Commission. She will help us understand what the situation in Ghana is as far as this, putting it in the context of this particular report. Nana, thank you very much for your time and welcome.
Thank you very much for having us.
So we've seen the world outlook, although just went through it briefly. Help us understand where Ghana sits in this context. What is the situation here in Ghana when it comes to drug usage?
As you rightly said, it's a very alarming figure, and the situation has really gotten worse. However, with the passage of the new Narcotics Control Commission Act 2020, that is Act 1019, that was in last year, in May 2020. This law has seen, it has brought more insight into the drug use, and it has changed the perception of the punishments regime with respect to those who use narcotic drugs.
Change for the better? Or
for the better.
For worse?
For the better. For the better. It's something, we are in a very traditional society, as you can attest to the fact. We are not ready yet so to say we are legalizing cannabis use or drug use or decriminalizing it or anything like that. So what we have done in this new law is that we are treating substance use disorder as a public health issue. Okay. So now, when you are caught in the possession of a narcotic drug for use, it is you will still be arrested. It's still an offense, but then there's a little bit of a change in it.
Can you help us understand this change? So first of all, I wanted us to have an idea about our usage, which you say is alarming. I'm not sure if you have the statistics to help us with Ghana's situation. If you don't have that now, we can move on and then you give us the highlights of what has changed in our new narcotics.
Okay.
Yeah.
What I can give you now is the highlights of what has changed in new narcotics.
Okay.
The new narcotics.
Let's go for it.
Yes, with respect to, basically, we have separated possession for use and possession for trafficking.
Okay.
And then also purchase for use and purchase for trafficking. And also there's an element of the license regime for the cultivation of cannabis, which the THC content is not more than 0.3%.
That too has changed. So let's take it one after the other so that we don't confuse the viewers and they can follow us. So the first is the purchase for, let me start from the purchase for use and purchase for trafficking.
Yes.
What was the previous regime and what has changed with the new law?
Okay, so with the previous regime was whenever you bought any narcotic drug and you were caught, that was it. There was no separation as to for use or for traffic.
You're not going to be asked whether you bought it to use or whether you bought it to traffic.
And no, you would be asked, but then for use, you will still have to go in for a minimum of 5 years.
Okay.
Imprisonment.
That you bought narcotics and you wanted to use it.
Yes.
You are likely to be in jail for 5 years.
Yes.
Okay.
But now, if you are caught in the possession of narcotics or you bought it for use, we go into it. Okay. Whereby we say that now with the sanctions or the penalties that are attached with the use of narcotic drugs is penalty. That is, the penalty is the fine. You have to pay a fine.
So you won't go to jail?
Not immediately. However, the modalities that come with it is that now we have something we have identified that substance use disorder is a public health issue. So we have to put the mechanisms in place, yes. But then what we would have to do is to certify you as having substance use disorder, in which the law allows the judge to, instead of sending you to jail or even asking you to pay the fine, the judge may direct that you seek treatment at a rehabilitation facility.
But we don't have the rehabilitation facilities as much as we need to get this operationalized, do we?
We don't, but then the law has even made provision for the establishment of a rehabilitation fund.
Okay.
Yes.
Okay, so that's a separate thing. Let's stick to this one first. So now, if you're caught in possession of narcotics and it's for use, it's established that you bought it or you have it for use, then you would be there. The judge is expected to direct you to be subjected to some sort of rehabilitation at whose expense?
The judge is not expected to.
Okay.
The judge may. The law says that the judge may direct that you seek treatment as a rehabilitation center.
Okay.
It's not at the expense of the user or the person with a substance use disorder.
The state is supposed to pay for it?
Yes.
Oh, wow.
And also not just the state as in the state in totality or in general. However, as I indicated, there's a substance use, there's a rehabilitation fund which the law has directed should be established by the commission, that is the Narcotics Control Commission. And that fund is supposed to be used to rehabilitate people with substance use disorder and yes, so there's provision. The provision has also been made for that. Okay.
So for purchase,
yes.
For what? For sale? Is it for trafficking?
For trafficking.
If you are caught with narcotics that you intended to traffic, what happens? What has changed?
Oh, for trafficking, not much has changed. Yes, it's still.
What happens to you?
You are caught with it. You are arrested. You are charged. You go to through the trial process, and then you are sent. If you are convicted, then you are sentenced.
How many years are we looking at for that?
Minimum of 10, maximum of 25 years.
Minimum of 10, maximum of 25 years. So let's talk a little bit about the fund. You're coming from the commission. Tell us a little bit about how this fund is supposed to be established. Who will pay what into this fund, and how operational? Maybe when will it be?
So the fund is supposed to be established by the commission, and it's supposed to be the law has created steps as to who to manage the fund. It's supposed to be managed by an independent trustee.
Okay.
And then the monies that are supposed to go into the fund are supposed to be solicited from donations, grants, that are raised from the public or from external sources, also from external sources and then internal sources, and then monies from Parliament as well. Okay.
It's external sources. When you say external sources, isn't it a bit too vague so that anybody else?
No, we can do donations. We can raise funds.
So I'm a drug trafficker, and I want to donate to
if you are telling me that you're a drug trafficker,
I won't tell you, but I'm just creating a scenario where I'm a drug trafficker, and because I want to legitimize myself, I find a way of becoming friends with the commission, because now you need money to create this fund, and I contribute a lot to this fund.
Oh,
how will the commission know?
The commission would know. It's not just that we will put a collection plates in public and say anybody at all should come and put money in there. To go through a process. It's a public organization. We don't just take from anywhere. We will do our investigations, and we're going to be authorized. There are certain places and people that will be willing to really receive money from. We have international donors. We have organizations, civil society organizations. Certain people would be willing to donate as well. So it's not that we would just go put a place in the marketplace and be asking people for money. Yeah.
So let's finish up with the highlights of the new law. We've talked about possession and the kind of sanctions that you'll be liable to should you be caught. What else can you share with us?
Okay, with respect to the new law, we had to, one of the main things in the law that is all over the place is the fact that we now have the provision in the law for the grant of license for cultivation of cannabis.
Yes.
So I may need to emphasize here that it's not for the cultivation of all cannabis or just any cannabis. The law has specifically stated that it has to be cannabis that the THC content is not more than 0.3% on a dry waste basis. So in this instance, it's not just any cannabis that you'll be licensed to cultivate. And this particular one, you have to go through certain processes. And also, apart from the fact that the type of cannabis has been restricted, it is also the cannabis that you are going to apply to the minister, the minister to be given license to cultivate has to also be used for industrial purposes, medicinal purposes. It's not for recreational use.
I see. Who will check all of these things? The commission.
The commission will check it.
and the PhD level and all that you said, how do I know? I mean, out of ignorance, can't I be cultivating a different kind of cannabis?
No, we will regulate that. We will regulate that so that it's not that you just go anywhere and then get your seeds or seedlings and then come to us to show us what you have and then we'll give you a license. No, it's going to be properly regulated.
So can a license be granted to a person who cultivates, you've indicated that under the new law, you can't be granted that license. What is the regime of inspection to make sure that somebody who has the license already and is cultivating cannabis is not abusing that license and sort of introducing all kinds of things?
There will be monitoring processes involved. It's not that once you are granted the license, we just leave you to go on your merry way. You're going to continue to monitor and then supervise and make sure that whatever it is that you have been granted the license to do, you are following through with it. Yes. Okay. And then this particular provision is going to be governed by a legislative instrument, which has not been passed yet, but is going to be properly legislated.
I see. Interesting. I mean, I don't know, but when it comes to monitoring and implementation of things, Ghana does not have a very terrific historical background. So we'll just leave it at that and trust that the system will go through it. But for people who are staying at home and not even aware about this, the use of cannabis, etc., what do you want them to take away from this conversation?
What I would like for them to take away from this conversation is that cannabis has not been legalized in Ghana. It is still an offense. When you are caught in the possession of cannabis, when you are caught using cannabis, when you are caught cultivating cannabis,
without license.
Yes. We haven't started giving licenses yet. So now, as the position is an offense. So the misconception surrounding it that we have legalized cannabis, it has been decriminalized, that is not the truth. So right now, the only way that you can actually say that you have been, you can cultivate cannabis or you can cultivate cannabis freely is when you are granted that license. And for now, Narcotics Control Commission, the Ministry of Health, Ministry of Interior has not started giving licenses out yet. So for now, if anybody is caught cultivating cannabis, it's still an offense.
Okay.
And you cannot smoke cannabis or use cannabis just around like that. It's still an offense.
Okay, that's the bits of the legal bits there. What about for parents and for young people who have the tendency of experimenting, not so legal, but not from a legal perspective? What kind of advice, as someone coming from the Narcotics Commission, would you give families and to young people
who would like to experiment the use of narcotic drugs? Just stay away from it. It's illegal. The use of narcotic drug is illegal. Do not do it. If you are caught doing it, it's an offense. You'll be prosecuted for it.
Okay. Well, is there anything else you'd like to add? Otherwise, that'll be it for me.
Nothing. And we want to just want to thank you so much for giving us the platform to be able to talk to the public.
Well, hopefully the message is going down and hopefully we'll be doing the right thing. I've been talking to Nana Benewa Frimpong-Bedu. She's from the legal department of the Narcotics Control Commission here in Ghana. So as you know, Ghana has not even started issuing any licenses for the cultivation of cannabis as yet, and it is not legal. We have not legalized the usage of cannabis. Even the law doesn't do that. What it does is that it allows it to a certain extent where you're using it for medicinal purposes, etc. So that's a bit of a clarification there for those who didn't know. Nana, thank you very much for coming.